Sleep apnea is a very common condition which can have a serious impact on your health and may be life-threatening. To better understand sleep apnea, you should understand how your body is expected to work and how untreated sleep apnea can change your body's normal functions. Starting with the basics, your body is made up of cells. Many cells together form tissue that combine to create organs. All of the cells and organs in your body need oxygen to thrive and to perform their expected functions. You bring oxygen into your body by breathing. Your heart's job is to distribute the oxygen you breathe to all of your cells. When your heart beats, it pumps blood into the small blood vessels in your lungs. The air you breathe is passed from your lungs to the blood in those small blood vessels. This is called oxygenated blood. The oxygenated blood is then pumped to all of your body cells to keep them alive and healthy. Once your blood deposits all of its oxygen into your cells and organs, it travels back to the heart to repeat the cycle again. Interestingly, one of your brain's many jobs is to monitor the amount of oxygen in your blood. The brain manages the oxygen in your body by controlling the number of breaths you take in a minute and how deeply you breathe. If your brain senses there is too much oxygen in your blood, your brain tells your body to take fewer breaths. If there's not enough oxygen in your blood, the brain signals your body to breathe faster or deeper. For example, when you're relaxed watching TV, your cells are operating at a low capacity because your body is in a resting state. If you got up and went for a run, your body would move into a higher operation. All the muscles in your body would be called into action to support your running. To operate at this new level, your cells would need more oxygen. Working together, your brain, lungs, and heart spring into action. By 1, your brain detects the need for more oxygen. 2, you breathe more quickly to get more oxygen. And thirdly, your heart beats faster to distribute the increased amount of oxygen. When you fall asleep at night, you go through different levels of sleep, from a light sleep to a deeper level of sleep called rapid eye movement, or REM. During sleep, your body relaxes muscle tone. The deeper levels of sleep, and especially REM, are necessary for your body's restoration and healing. Sleeping allows your body to rejuvenate muscle, regulate hormones, fight diseases, reduce stress on the heart, and calm inflammation in joints or injuries. When you have sleep apnea, the muscles in your airway relax during sleep to the point of blocking your airway. When a blockage occurs, you stop breathing. This is called an apnea. Your apnea can last between 10 to 40 seconds. Remember, your brain now detects a lack of oxygen and signals your body to breathe faster and for your heart to pump harder, but your blocked airway prevents any oxygen from entering your body. Detecting an emergency, your brain signals the release of a stress hormone called adrenaline to wake you up. This adrenaline shocks your system to wake you up just enough to regain muscle tone. Your airway opens, again allowing you to breathe. With breathing restored, your heart slows and the oxygen levels in your blood return to normal. When your apnea is over, you fall back asleep and your airway relaxes again, allowing the entire cycle of obstructed breathing to repeat. In fact, the cycle may repeat as many as 100 times or more per night. The most observable symptom of sleep apnea is chronic fatigue. Although you are unconscious for 8 hours at a time, you are truly not sleeping due to the repeated apnea and adrenaline cycle. But fatigue is not the only effect of sleep apnea. Serious health conditions, both immediate and long-term, can arise if left untreated. The stress hormones released put you at a potential risk for high blood pressure, congestive heart failure, heart attack, stroke, diabetes, obesity, and arrhythmias. The release of adrenaline also changes your blood sugars. If you're a diabetic, your blood sugars can be hard to manage during the night, and untreated sleep apnea can make this even more difficult. Continuous positive airway pressure, or CPAP, is the gold standard of treatment for patients with sleep apnea. It is not only effective, but it is customized for each patient. CPAP resolves sleep apnea by gently introducing pressurized room air into your breathing airway at a sufficient pressure to keep your relaxed airway open during all levels of sleep. CPAP ensures your body gets the oxygen your cells need and helps you get the healthy, restorative sleep that you need to reduce the risk of more serious health conditions like high blood pressure, heart diseases, and diabetes. As you can see, your body is made up of many complex systems that work together to keep you healthy. Using your CPAP machine helps your body regain its normal balance and function and to be healthy. And using your CPAP machine consistently is critical to your overall and long-term health. In fact, CPAP therapy improves your quality of life.